Biden announced today that he's directed the federal government to secure 100 million additional doses of Johnson & Johnson's COVID vaccine to boost the nation's supply. The race to vaccinate the country's population comes as those variants continue to spread. So are the vaccines able to combat the virus as it changes? And how long is the vaccine protection expected to last? Here's ABC's Bob Woodruff with this week's Vaccine Watch.
New strains of COVID-19 are spreading in the U.S.
These new variants account for 51% of all cases that we have in the city right now.
But so are the vaccines.
We're now on track to have enough vaccine supply for every American adult by the end of May, months earlier than anyone expected.
The good news is that the vaccines are working so far, holding their own against the more concerning COVID variants.
This latest lab study out of the New England Journal of Medicine does show some effectiveness against the variant that has been seen prevalent in Brazil.
This COVID variant, known as P1, is dominating Brazil. But a study showed that the Pfizer vaccine's effectiveness remained roughly equivalent as it had against previous strains.
So what these studies do is basically take the blood of somebody who's been vaccinated. The Pfizer vaccine is able to block the ability of this variant, the Brazilian P1 variant, which has some mutations which people were concerned about because they were thinking that they were seeing reinfections in parts of Brazil, were able to get around the vaccine. And it appears in this study that that's not the case, which is good news.
The B117 variant, otherwise known as the UK variant, which has been found in most U.S. states, has proven to be far more contagious. But several studies do show that available vaccines are equally effective against the strain as well. But scientists are keeping an eye on one variant, B1351, otherwise known as the South African variant.
Vaccines that have worked very well against the Wuhan strain are not working quite as well against some of the variants?
That's correct. It's working fine against the UK variant. It's not working as well against the South African variant.
That variant does seem to impact the vaccine, chipping away at overall effectiveness. But importantly, these vaccines are still equally effective at saving people from severe illness.
When they are faced with the Johnson & Johnson vaccine, for example, it's not 100% at preventing infection, but it seems to be better than natural infection, and it is clearly better at preventing serious disease, hospitalization, and death.
Not one person has died of COVID who's received the vaccine, any vaccine.
Shortly after this COVID-19 was identified inside China, scientists immediately began to prepare for the possible emergence of new variants. Pfizer, Moderna, and even Johnson & Johnson made vaccines that can be updated fairly easily to fight against new strains.
All what would be needed is to modify the RNA sequence to reflect the new variant sequence and then package it in the same way. So it's a very similar vaccine, just with a very slight modification.
Scientists are now testing modified vaccines. Moderna announcing today that trial participants in their new study were injected with a booster designed to combat the South African variant. But the current shots now available to us have not changed, and scientists don't believe that's necessary just yet.
So they are doing this in a proactive fashion, just anticipating a potential need that might arise.
In the United States, that if we could get everybody vaccinated with what we have now, we may not need a booster in the near future.
While the vaccines are working well, one question being asked is, how long will the current vaccines last? And will we need an update, a new shot, every year? The CDC now says vaccinated people can meet together inside without a mask.
How concerned should they be about the possibility that their protection may fade over time, may have faded already?
This is some of the data and evidence we are watching really carefully. Some of the science that we're waiting to emerge before we liberalize our guidance. It's the reason we're taking these baby steps.
But many scientists have already made an educated guess on how long vaccine protection may last.
The prediction or the thought right now is that we would have to get an update. We have to do another vaccine shot.
I think for now, we need to be prepared for vaccinating every 1 to 2 years.
But so far, this has not been proven. It's only been 3 months since Americans got their first shots. This is Bob Woodruff, tracking the vaccine.
So insightful. Once again, our thanks to Bob for that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.